I'm here to talk about the silent killer SIDS and how to reduce the risk. SIDS statistics and how to reduce the risk of it occurring to your family is my topic. My purpose is to persuade the community that SIDS is very real and ways to prevent it from happening to your family also. Hello. First, I'd like to introduce myself. My name is April. I am a survivor of SIDS. I have been telling people what SIDS is for many years. SIDS is a silent killer that claims the life of many infants aged 1 month to 1 year. Unfortunately, there is no known cause for this horrific death. I lost my son to SIDS in 2001. Here's my angel. I still would like to know how and if I could have done things differently to prevent it from happening. This is a question that many parents ask themselves, as I did myself. Hopefully, after this speech, I can answer that question. SIDS, also known as sudden infant death syndrome, is very real. Knowing the risk factors, statistics, and ways to prevent it from happening may help your family not have to go through this tragic loss. Now I'm going to talk about the risk and who is more vulnerable. Risk factors increase the risk. There is really no known cause for SIDS, though, as they tell at the Mayo Clinic. Risks are more boys die than do girls. The younger are more vulnerable for some reason. They still haven't found out why. Race, Black, Eskimo, and Native Americans are at a greater risk for SIDS. Secondhand smoke increases the risk. Family history. If there's a family history, of course, you're going to have a greater risk of SIDS. Knowing your family history will help. Maternal factors, smoking during pregnancy, drug use, and no prenatal care. Trying to eliminate these could reduce the risk of SIDS happening to your family. Now I'm going to talk about the statistics of SIDS and who is affected. According to the CJ Foundation for SIDS, these are the statistics that I have found. Right here, we got SIDS by numbers. 2,226 babies died from SIDS in 2010. Sleeping in a bed with an adult, you got 40 times greater risk of dying. 87% of deaths occur in unsafe environments, meaning like sleeping in the bed with an adult or sleeping in a bed that's not safe. 665 deaths, accidental suffocation. This would mean sleeping in the bed with yourself. Breastfed babies have a 60% lower risk. 25 times greater risk if they sleep on their tummies. They always say sleep them on their back, so then they're not at a greater risk for SIDS. These were all found from the CJ Foundation. Now I'm going to talk about ways to prevent SIDS from happening. There are many ways to prevent SIDS from occurring in your family. According to Amita Shroff at WebMD, she states that safe sleeping, sleeping on your back, putting your baby to sleep on their back and not on their tummies. Putting them in a firm bed, no soft mattresses. Avoid putting like bumper pads, blankets around them. Keeping your baby from overheating. You want to keep them at a temperature that you're comfortable. If you're hot, then the baby's hot. Keep your baby close and not in your bed. They have other things that you can use. Other ways to prevent SIDS, breastfed babies are known to not die from SIDS. So breastfeed as long as you can. Do not smoke. Smoking around your baby is one of the highest leading causes of SIDS, according to Amita Shroff at WebMD. Even with knowing the risk factors and ways of preventing, the silent killer will not stop SIDS. In conclusion, I'd like to state, if we as a community educate each other on the risk factors, statistics, and ways to prevent it from happening, we may help stop it from happening to your family. Although there is no known cause of SIDS and researchers are still looking for answers, we can raise awareness and help with the fight to find the cause. And if we do, then maybe we too can help in the search for the cause of the silent killer SIDS. Thank you for your time.